Hi, everybody. Mary Ferguson-Perret here, and thanks for joining us for On Location this week. And I'm here with lots of star folks from clinical nutrition, and we're here to talk to you about experiencing global practice at Weeneebayko Health Ahtuskaywin, as well as at UHN, and sort of going in both directions, or maybe we should say swinging both ways, or what would be the right thing to say. But I want to start by saying that we have Kathy here, and she has been really a prime mover in helping our clinical nutrition folks to get involved in this experience, not only to go to Weeneebayko, but for us to host Weeneebayko professionals here. Can you tell us a bit about that, Kathy?
Well, we've had a great deal of help from all of the dietitians in clinical nutrition. Beth was fairly explicit in some of her goals in coming here, and I put out a call for help from various areas that she indicated a specific interest in at this point, and we had quite a wonderful uptake from the renal dietitians, from other diabetes colleagues, as well as cardiology, and that's just a start at this visit. So I'd like to say thanks to all the clinical people who did help.
And I'd like to echo my thanks. Wonderful that we've had such an interest in supporting global practice. And I know also that you supported Tiffany. We'll talk to Tiffany in a minute, but you supported Tiffany to go to Weeneebayko as well.
Well, we were pretty excited about Tiffany going because she was the first allied health practitioner to go. And she brought us back some great stories. And I think we've got a great relationship now with the group in the north, and hope it will grow.
Good.
As time goes on.
So you mentioned, and I do want to mention, this is our first sort of allied health exchange, and I'm expecting it'll be the first of many, and that many other allied health groups will get involved, I hope. And so let's talk to our visitor and guest, Beth. You've come to us from Weeneebayko, Beth.
Yeah, that's right.
What's it like coming down here?
It's been a great experience so far. I'm the only dietitian right now at Weeneebayko, and I had been the whole time that I'd been working there, so it's fantastic getting to network with other colleagues, to share resources, and just seeing, in larger facilities, how things work.
Mm-hmm. And in case you don't know this, and maybe you better tell us, where is Weeneebayko so that the UHN audience will get that?
Sure. So we're located on Moose Factory Island, which is probably about 200 miles north of Timmins or Cochrane area. And it's just south of the James Bay. So we're on a little island in a river inland from the James Bay. So quite isolated.
And I know you serve the whole James Bay coast, right? Including up into Hudson's Bay, because Peawanuck is up there, right?
Yep, that's right. So I actually work for a diabetes program which services 7 different communities. And myself and a nurse do travel visits to all of the different communities and provide diabetes services and education there.
Well, fantastic, and we're so glad you're here and that you felt warmly welcomed, and it's been a good experience. And so let's talk to Tiffany. And Tiffany, you went to Weeneebayko to visit from UHN, and how long ago was that now?
Well, that was back in August and September of last year, so whatever that is, about 6 months or so. So yeah, it was a really good experience, and I'm glad that I was able to return the favor to Beth and have her come up and shadow me, because I think it was a very good experience to see both ways. It's a very different environment, and I'm glad that we both had the opportunity to sort of experience that and the differences that are within those.
So what difference do you see in terms of your practice being there versus being here?
I guess first of all, there's a lot more resources available here. So for example, in diabetes care, they work with endocrinologists quite regularly. You have a large pool. You've got nurses to pull in, different resources available, where we have family physicians but no endocrine specialty services. So quite frequently the questions I get and the nurse get, maybe questions an endocrine would get here, and we're trying to problem solve and find out, which is great, building the network and the relationship with these large centers with the resources. Other differences, I guess, everybody kind of has a bit more of a specialized area here, where in the north people become a jack of all trades and you kind of get into a lot of different areas. I know when Tiffany was there, she worked in prenatal nutrition and nephrology, on the floor, geriatrics, so you do a bit of everything, where here you get into specialized areas and, yeah, a little more in particular with services.
Well, so the theme here is that we can learn a lot from each other, and so for those of us who become really, really specialized, we can learn about the more generalized practice and have those wonderful experiences, and then you can also draw on the specialists here, and so it, each can support the other. And so this is a wonderful example of how we can continue this relationship, and I think it was like fun too. Would you say it was fun?
It was a ton of fun. It was really great actually to meet Tiffany in the north and then to come back and have somebody here in place that I could spend some time with.
Yeah.
And I think for other people looking into doing the placement, it's really great to have that partnership. So you have a familiar face here at University Health Network that can show you around, introduce you to people.
Well, I'm just so glad that you enjoyed it, as well as, of course, obviously it was mutually beneficial for both organizations and for both practitioners and for the whole department. And so I just want to encourage you, all of you out there, any professional group, if you are interested in participating in our Global Practice Initiative, you need to contact Biba Zarens, who coordinates the entire thing, and or myself, and I'll certainly refer you to Biba. Please join us in this wonderful initiative and this fun initiative as well. That's it for today. Talk to you later. Bye-bye.